Welcome back to part two of our three-part series. So, just to give a little synopsis, our last video, if you made it all the way through, I commend you. Amazing job. I'm trying to make these short to make them palatable. So, we talked about what are the problems in dentistry in terms of something that I can help out with as a physical therapist. The big problem is pain, a high prevalence of it. There's different presentations of it and all sorts of ways that we are different in how we can deal with that. So, um, what I wanted to talk about this section is why do we have pain? So this is going to kind of be very basic, be quick for you, but hopefully add to that discussion of why are dental professionals having pain and what can we do about it kind of thing. So it's going to be a little tough to kind of wrap our heads around it, but we'll start with something easy and what we think causes the pain. And it does a little bit, but it's probably not the only cause. So probably one of the first answers that I got from me posing why do we think that we have pain is the dental professionals' working positions. They have a very hard position and they have to finesse their body around your head to really get in there. We all know this. So you could be going over somebody, you could be going to the side, you could be completely to the side, and your body's twisted. It's leaning over. It's contorted. So is that something we can really change? Well, uh, Bethany Valachi, pioneer in the dental field as a physical therapist, her main purpose is to help out with ergonomics. And I'm here to say ergonomics is so helpful, but it's not the only piece of the puzzle. This is why I'm here to try and explain that to you. And I'm sure you've received a lot of education in your clinics, your doctorate program, your hygienist program, all of that stuff. And I'm sure you've had people help you out with that. That's great. If you do the math, work equals force times distance. So technically, if you're doing more work, your force is either higher or your distance that you're doing the work is higher. So if something's really close to me, I'm doing less work even at the same load, holding on to something. But that same load, if I bring it further away from me, now I'm doing more work. That's more work for your body to do, and that's more work for your body to try and handle throughout a 6, 8, 10, 11-hour day. That's a lot of compounding work that, do you really have to do that, or is there a better way? So that's what I want to add to the discussion is posture. So, full disclosure, I am not an ergonomic consultant. I'm not a specialist. Everything, all the research that I've done, all the studying that I've done, it is not certified by a certification or anything like that. This is just strictly knowledge that I want to achieve and help out my patients with. So, number two, repetitive movements. So, you guys not only have to sustain that posture that you're doing, but you're very skilled and you have to do repetitive work. The poor hygienists have to do a lot of work in such a small area. The oral surgeons might have to bend forward to do stuff. The general dentist might have to go from front to the side. You know, everybody's different. But the main common factor is you're not moving your body. That's just a part of your work, your job. Is there anything we can do about that? So that's not only rhetorical, but I'm also going to give some suggestions later on. So with ergonomics or your biomechanics, we talked about sustained postures. Is there anything else that could be causing your pain? So what I want to tell you about and kind of show you the wide variety of why we have pain. Fasten your seatbelts. This is a lot, but I'm going to try and condense it. So we're going to try and condense it down into our biology, our psychology, and also our social factors, our sociology, or everything around us. So you're probably thinking, okay, but how does that relate? Pain and our whole experience with everything is so multifactorial. And pain, if you look at the maps in the brain where we perceive pain and where it lights up when you stimulate pain, it is all over the whole parts of the brain. So the parts in the front that deal with executive functioning, the parts in the back that deal with eyes, vision, um, the parts of the brain that are in the middle that deal with memory, they're all wired and pieced together. So the more of these pieces that are wired together, the more of the pieces that are connected and light up, the more pain that we technically could have. So this has been shown on different studies, different things. So I'm not going to go anything past that, but my point is that it's so multifactorial. It it can really be not just about one thing, which I'm sorry to say. This is what we want to hear. I go to a doctor and I say my throat hurts. I want to hear that it's strep throat and that all I have to do is take antibiotics. I have this. This is all I have to do, and then it's done. I'm sorry, that's just not the case about pain. I'm not here to sugarcoat it, but more educate you about how comprehensive and how complex pain really is. So we really do have our work cut out to not only treat the underlying factor of what's causing your pain, but everything else that contributes to your pain. So it's not just tissue damage. Have you ever noticed you just got out of the shower or you're changing your clothes and you look at your leg? Where did I get that bruise from? You had no idea 5, 10 minutes before that you even had a bruise, but that's technically tissue damage. It's a bruise. Why didn't it hurt before? Well, I'm here to kind of elaborate a little bit on that. So, just breaking it down very basically, the biology portion of it, we'll just dumb it down to like our tissues. That could be an obvious source of pain. You cut yourself, there's receptors that say, boom, there's pain, danger, danger. It signals your brain, and then you feel that. But then also, what are some things that can cause changes to those tissues besides like an abrasion, a blunt force trauma, stuff like that? So what what speaks most to me as a musculoskeletal expert is our muscles, our bones, our ligaments, like that. So our activity levels, how resilient is our body to the demands that we put on that. So if we're if we're talking about a sedentary population, they they work all day, they get home, they turn on the TV, they get dinner going, they put their feet up, and they relax. Well, they're not doing anything outside of their job to really prepare their body for the demands that they have. So their body gets used to maybe at the limit of doing your job, which is, it could be a lot of work, it could be a little, everyone's different, but we're talking about dentists here. It's it's very skillful and it's very concentrating. So um, you really need to be on your game when you're working with your patients. Also, if you look at the other side, if you work out a lot, you can lift heavy weights. Now that sets your tissues to be able to tolerate so much more than what you do for work. The different instruments that you hold are nothing compared to some of the weights that you're able to lift or maneuver. The question is, can your body tolerate holding that technique or that instrument, whatever you're doing, for a sustained period of time? So that's what I'm here to help explore. So now we're going from the biological to the psychological. Now this encompasses a whole lot. Psychology is it's just too much to try and explain right now. But if you think of it as try and bring it down a little bit, I think of our mood, um, our stress levels, our anxiety. Is there any signs of depression? We want to include our beliefs about this pain. So, are we somebody that says, this is my MRI, it shows I have a herniation, this is the cause of my pain? Well, you try and convince them otherwise, they might not believe you because their wholeheartedly psychology is believing in this one thing is causing my pain, and there's nothing you can do to tell me about it. Okay, well, we have some work to do to maybe consider some other things that might be causing your pain. But the mind is so powerful. What our beliefs are about pain can really affect how we deal with or how we experience pain. So there's a lot of other stuff, but I'll get to the social factors. So biological factors, psychological factors, and now social factors. So our sociology. So just trying to keep it very basic. This is our social support. This is our family, our friends, our work environment, people who you work with, your coworkers, all that. So if you have really good support at home, really good support in the office, chances are you're in a better mood, you're more motivated to be happy and follow that culture. If you're happy at home, if you're happy at work, likely there's less stress, there's less anxiety, hopefully no depression with that, and your mood is probably really good. Now, we'll just say if you're in an environment where you're very dissatisfied at work, okay, you have a boss that's nagging at you of your productivity, but you're already seeing a ton of patients. You're anxious because how can you fit more patients competently and ethically to make these quotas when your bucket's already full? So that can create a lot of stress and anxiety at work. That's not to mention patients. Are some of those patients rude to you? Do they come in, they're just not listening? They come with the same thing, even though you tell them, okay, I want you to floss before bed, this or that. I want you to do this, do that. They're not listening to you. They don't care. How does that make you feel? For me, I feel like as a physical therapist, I want to try and sell them on their health. I want to try and convince them, and if they can come up with the solution and help themselves, boy, I couldn't ask for anything else. But if it's like, no pun intended, if it's like pulling teeth, trying to get them to do their treatments, their interventions, it's gonna create a little stress in my workday. And if you compound that with all the patients you have every day, all week, all month, all year, it could add up to a whole lot. So the social factors of your home, your work life, and all that can really affect your pain. And I wouldn't be in this field without mentioning our wellness. Sleep. Sleep is huge. That's our recovery from our nights or our whole day of work demands, our stress levels, everything that goes with our work life balance. Secondly, our nutrition. What are we putting inside our bodies? Do you not have enough time at work? So then you're forced to go out and get fast food and quickly hoover something before you're back to work? Or do you make time to meal prep your foods? Are you tracking your calories? Stuff like that. Do you have goals that you're trying to hit? That really affects pain as well, what you fuel your body with. Also, hydration. This is one that, so I'm in Arizona. Growing up, I really didn't get the importance of hydration. Um, and it matters so much here because it's so hot. We can't be dehydrated if we're trying to either compete or work at a higher load, and your body's just depleted of all properties, all that good stuff. We need that to function. We need that to help fuel our brain to transport oxygen, transport energy, get rid of the bad stuff, the toxins. So those are really, really big, low hanging fruits that we can help with to help dim or modify our pain experience. All this affects our pain, um, and I'm here to tell you, I'm not sure if you know this, there's something we can do about it. So this is so exciting. This is what our next series is about, so stick with us. Let me know if you have any questions on what causes pain. I was very, very brief on all these huge, huge things to do with our body. Our body is all encompassing. We don't just look at your body as a vessel. We look at your mind, body, um, your spirituality, how you think about things, and it's all different. Nobody is the same. Therefore, nobody should get the same evaluation or treatment or approach. We have to figure out who you are, what your beliefs are, what's going on, and tailor a comprehensive approach to help you and treat you properly. So, next one is, what can we do about it? Stick with it. Let me know. Can't wait to see you all.